There's nothing left to treat.
Dr. Reeves signed the order without looking up. They would pull the ventilator in 30 minutes. Tessa Delaney was still at the bedside when she saw at the index finger of his left hand moving. Not a spasm, a pattern. 2 taps, pause, 3 taps, pause, 1. She had last read that sequence in a classified signals room at Fort Meade. This man wasn't in a coma. He was transmitting. A Navy SEAL sniper trained to outlast anything was commanding his own body to shut down because his mind still believed he was a prisoner of war. The only thing that could save him was a code name Tessa had no right to know. If you're new here, stories like this one come out every week, the kind that don't make the news, but probably should. Subscribe so you don't miss the next one. The C-17 touched down at Landstuhl Regional Medical Center at 3 in the morning in the middle of an October rainstorm that had been hammering southern Germany for 2 days straight. Nobody on the tarmac spoke. The ground crew moved fast and silent, the way people move when they already know whatever is coming off. That aircraft is beyond bad. The stretcher came down the rear ramp, flanked by 2 special operations medics who had clearly not slept in longer than was medically advisable, and even in the dark and the rain, with his face half covered in field dressings, the man strapped to it looked like something the desert had tried to swallow whole and then spit back out at the last second. His name was Evan Rourke, though that name did not appear in any document accessible to the receiving team at Landstuhl that night. What they had instead was a 9-digit patient number, a single line of text indicating Special Operations Command authorization, and a medical summary so redacted it was nearly useless. What they could see with their own eyes was a large-caliber entry wound that had destroyed his right shoulder and punched through the chest cavity, shrapnel embedded in both legs, deep enough that the field surgeons had left the fragments in place, rather than risk further bleeding during transport burns, across portions of his back and left arm, and a right lung that had partially collapsed sometime during the flight, and been reinflated with a needle by one of the medics who had done it without anesthesia because there had not been time. By any reasonable measure, Evan Rourke should not have been alive when the wheels touched German soil. The fact that he had less to do with luck than with the kind of physical conditioning that turns a human body into something that simply refuses the ordinary rules. Dr. Malcolm Reeve met the stretcher at the trauma bay doors. He had been the chief trauma surgeon at Landstuhl for 11 years, long enough to have seen injuries that would have been career-defining emergencies anywhere else become something close to routine. He had rebuilt men who arrived in pieces. He had kept people breathing through nights when every monitor in the room was screaming that it was not going to work. He looked at Evan Rourke for 30 seconds, absorbing the full picture, and then he looked at the medic closest to him and said simply, "Get me 6 units of O negative and tell OR2 we're coming up in 4 minutes." He did not say what he was thinking, which was that 4 minutes might already be optimistic. The surgical team worked for 6 hours. They stopped the primary hemorrhage, repaired the chest wall, re-expanded the lung with a proper chest tube, extracted what shrapnel they safely could, and marked the rest for later, cleaned and debrided the burns, and stabilized the shoulder enough that it would not cause immediate secondary damage. It was careful, skilled, exhausting work, and by the time Reeves stepped back from the table and looked at the monitors, the numbers had moved into a range that was still critical but no longer immediately fatal. He told his team they had done well. He believed it. He also believed, with the particular intuition that comes from 11 years of watching bodies fight or surrender, that something about this patient was going to be different. I was not wrong. He just did not yet understand how. Tessa Delaney had been on the night shift in the ICU when the call came through that a SOCOM patient was incoming post-op and would need continuous monitoring. She had been at Landstuhl for 3 weeks, long enough to know the rhythms of the unit, short enough that most of the permanent staff still thought of her as the new civilian nurse who was quiet and competent and kept to herself. That description was accurate as far as it went. It just did not go very far. Before she had ever set foot in a nursing program, before she had learned to read an EKG or manage a central line, Tessa had spent 6 years in a building at Fort Meade, Maryland, that did not appear on most maps, doing work that she was still technically prohibited from discussing in detail with anyone who did not hold the appropriate clearances. She had analyzed intercepted communications, broken down the physiological stress signatures of operators in the field, and spent entire weeks doing nothing but listening to recordings of men under extreme duress and documenting how their bodies responded. She had left that world because of a specific night in Afghanistan that she had spent years learning not to think about, and she had gone into nursing because she needed to be in rooms where she could see the outcome of her work with her own eyes in real time while the person was still breathing. She was good at it. She was also carrying 6 years of classified knowledge that had no obvious place in an ICU, and she had gotten used to the feeling that it probably never would. Evan was transferred to her unit in the early morning hours, and she took his vitals, checked his lines, read through the abbreviated surgical notes, and settled in for what she expected would be a long and demanding, but medically straightforward recovery watch. He was sedated. His numbers were stable enough. The plan was to bring him up slowly and see how his body tolerated the transition out of the deepest phase of trauma. The plan stopped working on the second day. It started with the adrenaline response. Reeve had ordered a low-dose epinephrine protocol to support Evan's blood pressure, which had been dipping in the night, and instead of responding the way it should have, Evan's heart rate had slowed. Not dramatically at first, just enough to be noted, flagged, and attributed to an unusual individual response. They adjusted the dosage. The rate slowed further. They tried a different vasopressor. His vascular resistance moved in the wrong direction. When the respiratory therapist increased the ventilator's oxygen delivery to compensate for the lungs' continued weakness, Evan's airway tightened, the muscles of his larynx contracting against the flow, as though trying to block it, and it took 20 minutes of manual adjustment to get his oxygen saturation back to an acceptable level. Reeve stood at the bedside that afternoon and looked at the readings with the careful, neutral expression of a man who has learned not to show uncertainty in front of his staff, and then he went to his office and sat quietly for a while. There was no physiological explanation for what he was seeing. Every intervention that should have helped was making things worse. The body in bed 4 was not failing to respond to treatment. It was actively, systematically rejecting it. By the third day, Evan's EEG had flattened to near silence. His organs were beginning to show the signs of sequential failure. The kidneys, most notably, then the liver. He had stopped responding to any external stimulus. Reeve used the word coma in his documentation because it was the closest available clinical term, but privately he was aware that the word did not actually explain the mechanism. Comas had recognizable causes. This did not. What this looked like, if Reeve had been willing to say it out loud, was a man who had decided at some level that predated conscious decision-making that he was finished. The call to notify command went out that morning. By afternoon, a man named Captain Nolan Vance had boarded a flight from the United States. He arrived at Landstuhl carrying the particular stillness of someone who has received bad news and processed it into operational focus, and he told Reeve that he was there to ensure appropriate protocol was followed and to be present for whatever came next. He did not say he was there to grieve, but Tessa, watching from the doorway, thought that might be the more accurate word. The prognosis Reeve delivered was 48 hours before they would have to consider withdrawing life support. Probably less depending on the kidneys. Tessa took the overnight shift that night, because the day nurse had a family situation, and because, truthfully, she had found herself reluctant to be far from room 4. She could not have said exactly why. She told herself it was professional attention to a complex case. She sat by his bed in the low light and did the things she was there to do, checked his lines, monitored his pressure, updated her notes, and somewhere around 2 in the morning, she reached for a basin of warm water and a cloth and began cleaning the dried blood and field grime from his hands, which the surgical prep team had cleaned imperfectly in the rush of the first hours. She was working on his left hand when she felt it. His index finger moved. Just slightly, just once, and she nearly logged it as an involuntary muscle response and moved on. But then it happened again, and again. And she realized with the particular slowness of a recognition that the conscious mind resists because it is too strange to immediately accept that it was happening in a pattern. 2 taps. Stop. 3 taps. Stop. 1 tap. Stop. 2 taps again. She set down the cloth. She pulled a notepad from her pocket. She carried one always an old Fort Meade habit, and she began writing down the sequence. Her hand was steady. Her breathing was not. Because she had heard this before, in recordings, in transcripts, in the long, careful analysis of signals that came from places where American operators were not officially supposed to be. She knew what she was looking at. It was a SEER tap code modified the specific variant used by special operations personnel trained for high-risk capture scenarios, a system designed to function when the body could not speak and the mind needed to keep communicating regardless. She had spent 18 months studying these exact patterns. She had a thesis's worth of documentation on them sitting in a classified archive she no longer had access to. She decoded what his finger was telling her. Captured. Identity compromised. Rescue failed. Deny all information. The room felt very small suddenly. She looked at the EEG readout, which showed almost nothing, and then she looked at his hand, and she understood that the 2 things were not contradictions. They were the same fact viewed from different angles. Evan Rourke's brain was not dead. It was hidden. He had folded his consciousness down into the smallest possible space behind every defense his training had ever given him, and he was running a survival protocol that his nervous system had apparently decided to execute, even at the cost of his own organs, because the alternative being accessible, being readable, being recoverable by whoever might be in the room was the thing his training had told him was more dangerous than dying. In his mind, the fluorescent lights overhead were interrogation lights. The pressure of the IV needle was a controlled application of pain. The sounds of the monitors were enemy communications he had not yet decoded. Every time a doctor had reached for him with a syringe or a ventilator adjustment, every act of treatment had registered in some deep, non-verbal part of his brain as coercion, and the response had been the only one available: resist, close down, refuse. I was not in Germany. He was still in the desert. He had never left. The door opened, and Dr. Reeve walked in, followed by Captain Vance, and Reeve was carrying a chart, and Tessa knew before he spoke what the chart meant. The kidney function had dropped below the threshold. Reeve said it quietly, professionally, with the particular gentleness that long practice gives to the delivery of irreversible decisions, and then he picked up a pen to sign the withdrawal order. Tessa stood up from the chair. She placed herself between Reeve and the ventilator, and she put the notepad on the rolling tray table in front of him. The notepad with its columns of taps and pauses, and the decoded sequence written beneath in her small, clear handwriting. She said she needed 30 minutes before any equipment was touched. She said the patient was not in a coma, and that pulling the ventilator would not end his suffering. It would confirm to the part of him that was still fighting that his cover was blown and he had nothing left to protect, and that part would simply let the rest of him go. Reeve looked at the notepad. He looked at Tessa. He said that involuntary muscle contractions were well documented in patients at this stage of neurological decline, and that what she was describing was not medically supportable. Captain Vance looked at her with a different kind of attention, the kind that is not medical skepticism but something more pointed, something that wanted to know exactly how a civilian ICU nurse could read a classified special operations tap code at 2 in the morning in a German military hospital. Tessa understood that answering that question was going to cost her something she had spent years protecting. She understood it, she weighed it, and she answered anyway. She had not always been a nurse, she said. Before this, she had worked in signals intelligence at Fort Meade. She had worked directly with the Joint Special Operations Command. She knew what she had just read on that notepad, and she knew what it meant, and she was asking for 30 minutes. Reeve held the pen without moving. Vance said nothing. The monitor beside the bed produced its steady, almost empty sound. Tessa did not step aside. Reeve took the 30 minutes because Tessa had put something physical in front of him, a notepad with a sequence. He could look at a claim specific enough to be falsifiable, and a professional history that, if true, changed the nature of what he was looking at in bed 4. He did not agree with her. But he was a careful man, and careful men do not pull ventilators while there is still a variable they have not accounted for. He told her 30 minutes, and he told her that if she could not produce something measurable in that window, the order stood. Captain Vance did not leave the room. He positioned himself near the door with his arms at his sides and his eyes on Tessa, and it was the look of someone doing rapid private calculations. He had asked how she knew the tap code, and she had given him an answer, and now he was deciding what to do with that answer. His voice, when he finally spoke, was level and careful. He said he would need to verify her background before the conversation could continue, and he stepped into the hallway to make a call. Tessa could hear the low sound of his voice through the door, but not the words, and she did not try to listen. She was already at the bedside. She had 30 minutes and no clear plan, and Evan's heart rate on the monitor had dropped to 22 beats per minute. Whatever mechanism he was using to slow his own body down. It was still running, still grinding toward a finish line that looked like cardiac arrest. The window was not 30 minutes. The window was whatever came first. The problem was that waking Evan up, if it was even possible, required giving his brain something to trust. A reason to stop. His training had built a wall between his survival instincts and the outside world, and the only thing that could reach through that wall was something his brain already recognized as safe. A voice he knew, a code his unit used, a signal from inside the system he had been trying to protect. Tessa did not have any of those things. She had a notepad, a set of skills she had not used in 3 years, and a memory that she was now pressing very hard. She thought about Somalia. She thought about a specific afternoon in 2023 when she had been assigned to a batch of intercept recordings from the Horn of Africa, and one of them had stayed with her not because of what it said strategically, but because of the voice. A sniper calling in close air support, while his team was surrounded alone on the radio, completely calm, in a way that had nothing to do with the absence of fear and everything to do with the presence of discipline. She remembered the call sign he had used to identify himself to the strike coordinator. She remembered it because it had struck her even then as a strange thing to hold on to a 2-word phrase that meant almost nothing outside of that specific context and everything within it. Whisky actual. She had no proof. The recording had been classified, and she had no access to it now, and even if she had, it would not have told her definitively that the man on the stretcher in front of her was the same man who had spoken those words. She was working from a voice she had heard once 3 years ago, through a degraded audio feed compared against a face she had been looking at for 3 days in a trauma ward. It was not evidence. It was the particular kind of guess that you make when all the real options are gone, and the only thing left is the one that might be wrong. She reached out and placed both hands on his left shoulder. The destroyed right one, the left one, the one still capable of feeling pressure, and she positioned her grip the way she had seen described in the extraction protocols. She had spent months analyzing the specific two-handed contact used during combat casualty evacuations to orient a disoriented operator to the presence of a friendly. Then she leaned close to his left ear, and she spoke quietly and clearly, using the tone she had heard coordinators use in recordings, not urgent, not pleading, just steady and certain, the voice of someone who already knows the situation is under control. Perimeter is secure. You're on the aircraft. Come back to us, Whisky Actual. The monitors continued their low sound. Nothing changed. She kept her hands where they were, and she kept going the same way you keep pressure on a wound even when you cannot see whether it is working. I have the watch, Whisky Actual. You can stand down. What happened next was not gradual. Evan Rourke's heart rate went from 22 to 140 beats per minute in approximately 4 seconds. His chest came off the mattress. Both eyes opened at once, wide and immediate, and completely without the foggy disorientation of a normal waking. This was not someone coming up from anesthesia. This was someone who had been fully awake inside a locked room and had just heard the door open. His left hand came up and closed around the collar of Tessa's scrubs with a grip that had nothing compromised about it, and he pulled her down to within 6 inches of his face, and he looked at her with eyes that were scanning, measuring, deciding. Reeve was already moving. He called for a sedation push, and 2 members of the nursing staff started toward the bed, and Tessa turned her head and said with a clarity she did not entirely feel that if anyone administered a sedative in the next 60 seconds, they would lose him again, and this time there would be no getting him back. She said it in the same tone she had used to reach Evan, not a request, not a question. Reeve stopped the team with one hand. Evan's grip on her collar did not loosen. His eyes moved across the room, taking in the walls, the ceiling, the equipment, the 2 other people near the door, and the movement was methodical in a way that was almost clinical, the systematic threat assessment of someone running a protocol that had nothing to do with the context they were actually in. The shoulder wound had reopened at the movement, and blood was darkening the bandage again, and Tessa could feel the tension in his hand and knew that it was not aggression. It was the last available form of orientation hold onto the one person whose signal had reached him while the rest of the situation got processed. She told him the name of the hospital. She told him the city. She told him the country. She told him the date. And then she told him again, slower, and she watched his eyes while she spoke and waited for something in them to shift. It took time. He was fighting his own brain, trying to override a threat response system that had been running at full capacity for at least 72 hours and did not want to believe that the emergency was over. Tessa had read enough about this specific mechanism to know that you could not argue with it directly. You had to give it something real to hold on to something specific and verifiable that the threat assessment function had no choice but to update. His grip on her collar finally loosened, not all the way but enough. His breathing was coming in hard, deliberate pulls, now each one an act of will rather than reflex. And she realized he was going to pull the ventilator tube himself, and there was nothing she could do to stop it, and perhaps nothing she should do to stop it. He reached up with his left hand and extracted the tube in one steady motion, and the sound he made was not a scream, it was just the sound. a body makes when something that has been blocking its airway is removed involuntary and raw, and then he was breathing on his own, and the oxygen saturation monitor dipped and then held. He looked at her and said in a voice that was almost unrecognizable from 3 days of disuse that she needed to verify her identity. Tessa said she had used his call sign to reach him. Whisky Actual. She had known it, and she had used it correctly, and she had used the correct extraction contact protocol with it, and that was her verification. Evan's eyes did not soften. He said that the Russians had broken SOCOM call signs before. He said that a fabricated hospital, fabricated medical staff, and a stolen call sign were all standard components of a psychological interrogation designed to make a captured operator believe the mission was over and lower their information security. He said it the way someone recites something they learned so thoroughly that it became reflex, not as an argument, but as a structural fact about the world he was currently operating in. Then he looked at her and issued the last line of defense his training gave him. Broken arrow, identify. The words landed in the room like something physical. Tessa knew exactly what they meant. Broken arrow was a last resort authentication challenge, a verbal test used by operators who had reason to believe their environment had been compromised and needed to verify that the person in front of them held current legitimate access to classified command channels. The correct response was a rotating code changed on a cycle she no longer had access to, held in systems she had not touched in 3 years. Captain Vance moved forward from the door. He identified himself by rank and branch, United States Navy Special Operations Command, and he told Evan directly that the mission was over and he needed to stand down. Evan's eyes moved to Vance for exactly 2 seconds and then moved back to Tessa, and that was the only response he gave. Vance had the rank and the branch and the correct bearing, and Evan had apparently decided that none of it was sufficient, because Tessa was the one who had used the right words, in the right way, in the right order, and that made her the one variable in the room that could not be immediately dismissed. She understood in that moment what he needed, and why she could not give it to him. The authentication codes rotated every 72 hours as a standard security measure. Even if she had still been employed at Fort Meade that morning, the specific response to Broken Arrow would have required a secure system lookup she could not perform from a hospital room in Germany. 3 years out of the system, she did not even know where to begin. Vance could not transmit it through an unsecured line without potentially compromising the protocol entirely. The institutional machinery that could theoretically produce the right answer was not built to move at the speed this situation required. She looked at Evan and told him the truth. She did not have the current code. His expression did not change in the way that expressions change when someone is surprised. It changed in the way they change when something expected has been confirmed. His hand, which had been resting open on the mattress, closed slowly. His eyes went to the ceiling and stayed there, and the quality of his breathing shifted, less effortful, more contained, the particular steadiness of someone who has decided something and is now preparing to carry it through. Everything that had kept him alive for the last 30 minutes was now working against him. His heart rate, which had surged to 140, was already beginning to descend. Not quickly, but with the awful consistency of something that had a direction and intended to follow it. Reeves' team could see it on the monitors, and no one in the room spoke. Tessa had gotten Evan back from the edge, had proven his consciousness was real, had bought him 30 minutes that had turned into something that felt briefly like a rescue, and she was now standing in the room where he might die anyway, having run out of the one thing that could have told his brain that the war was finally over. Tessa made a deliberate choice to stop looking at the monitor because the number on the screen was going in one direction, and watching it would not change that. And she needed every part of her attention on the man in the bed and not on the machinery recording his descent. She had no code. She had no current clearance. She had no institutional authority of any kind in this room. What she had was 3 years of classified work that she had never been permitted to talk about, and had spent considerable effort trying not to think about, and the specific, detailed, almost photographic memory that had made her valuable at Fort Meade in the first place. She pulled the chair to the edge of the bed and sat down so that her eye level was close to his, and she spoke in a voice quiet enough that Reeve and Vance, standing near the door, would have had to move closer to hear her clearly. She told Evan she did not have the current broken arrow response. She told him she understood what that meant to him and why it mattered, and she was not going to pretend otherwise. But she said there was another way to verify her if he was willing to listen, and it required him to decide whether the things she was about to tell him were things an interrogation team could have fabricated, or things that could only exist inside a file that very few people had ever been permitted to open. Then she started talking. She told him his unit had been attached to a forward element operating out of Camp Lemonnier in Djibouti during the operational period that preceded his current deployment. She told him the primary extraction corridor for his team ran through a dirt airstrip outside a place called Balam. She told him that his last confirmed radio transmission before the incident had referenced 3 armed vehicles moving on an intercept heading, and that the transmission had come in at a signal quality that suggested his equipment had already taken some physical damage by that point. She told him his baseline resting heart rate recorded during his last pre-deployment medical screening was 42 beats per minute, low enough that it had been noted as a point of interest by the flight surgeon who cleared him. She told him he was allergic to penicillin, and that this allergy had been a standing annotation in his medical record since his first year of service, and that the team at Landstuhl had been working around it since the night he arrived. And then she told him something that carried more weight than any of those details. She told him that in the spring of 2021, she had been assigned to monitor biometric data feeds from a long-duration reconnaissance operation, and that one of the operator profiles in that data set had been his, and that she had spent 11 days watching his heart rate, his respiration, and his stress response patterns from a room in Maryland, while he was in a location she was not permitted to know the name of, doing work she was not permitted to ask about. She had watched over him once already, she said. From the other side of a system he never knew was listening. The room had gone very still. Evan's eyes had not moved from her face during any of it. His expression had not changed in the way expressions change when someone is being convinced. It had changed in the way they change when someone is recognizing something, when the pattern of incoming information crosses a threshold and the brain stops arguing with it and begins instead to reorganize around it. His hand, which had been closed on the mattress, opened. The rigid set of his jaw loosened by a fraction. These were small things, but Tessa had spent years learning to read the physical signals that people did not know they were sending, and she knew what she was seeing. She looked at him directly and said she knew what he had done. She knew he had tried to die on purpose in a controlled way to make sure that whatever was still inside his head could not be reached by whoever might be waiting on the other side of his rescue. She said it plainly, without judgment, because it was the truth, and he deserved to hear it treated as the truth rather than as a symptom. Evan's gaze went to the ceiling. It stayed there for a long moment. Then he said in a voice that was still rough from the ventilator tube and everything that had preceded it, "I'm in Germany." Tessa said yes. He said it again, quieter, the way a person says something when they are not repeating it for the room, but testing it against the inside of their own mind, checking whether it holds. And then something happened to his body that was the opposite of everything that had been happening for 3 days. His blood pressure, which had been falling, began to climb. His oxygen saturation steadied and then improved. The heart rate that had been grinding downward turned and began slowly to rise. It was not dramatic. It did not look like the movies. It looked like a machine that had been running the wrong program, finally receiving the correct input and beginning one system at a time to return to its proper function. Dr. Reeve was watching the monitors, and his expression was the expression of a man revising a foundational assumption, which is not a comfortable thing to watch someone do in real time. The next several hours belonged to medicine. Reeve brought his team back in, and they worked steadily and without the crisis mode intensity of the previous days, because the body in the bed was finally cooperating, accepting the blood products, tolerating the oxygen, allowing the repairs that had been made to begin actually healing. The kidney function numbers began to move in the right direction. Tessa stayed in the room throughout, not because she was officially assigned to it, but because Evan's eyes, when they were open, tracked her location with the quiet consistency of someone who has found solid ground after a long time without it, and is not prepared to lose sight of it again. By morning, the situation had stabilized enough that Vance brought in a secured satellite communication unit and came back to the room with the formal, careful demeanor of someone who had been on the phone with people significantly above his pay grade for most of the night. He told Evan that command needed a full account of the incident, the ambush, the casualties, the sequence of events that had led to 6 members of the team being killed and Evan being extracted alone. He said it with appropriate gravity, and he waited. Evan looked at him for a moment. Then he said he was not going to give that account to Captain Vance, and he was not going to give it through any of the standard reporting channels. He said this without hostility, as a statement of operational assessment, rather than personal refusal. The channels that would normally receive this kind of debrief had been compromised. He did not yet know how far the compromise extended, and until he did, he was not going to feed information into a system that might route it directly back to the people who had tried to have him killed. Then he looked at Tessa and said she was the one he would talk to. Vance started to object, and Evan cut him off with a single sentence. He said Tessa was the only person in the building who had reached him through a channel the hostile network could not have anticipated, using information that could not have been fabricated without access to compartmented files that the hostile network had not, as far as he could determine, penetrated. That made her the only person in the room whose presence he could currently verify as clean. Vance looked at Tessa. There was a long moment in which nobody moved, and then Vance took the satellite unit and walked out of the room and closed the door behind him, and Reeve followed, and it was just the two of them, the nurse who used to be something else, and the sniper who had spent 3 days trying to disappear. Evan told her what had happened. The mission had been surveillance only, no engagement authority, no offensive posture, just eyes on a weapons transit point in the Sahel that the intelligence community had been trying to map for several months. 6 people, a fixed observation position, scheduled radio check-ins on a rotating frequency protocol. It should have been a long, quiet, uneventful operation. At 2 in the morning on the 4th night, it became something else entirely. A force of between 15 and 20 personnel hit them from 3 directions simultaneously using a U-shaped ambush formation that required precise knowledge not just of the primary position, but of the fallback route, the secondary extraction path that existed only in the internal planning documents of the team itself. Evan's point man was killed in the first volley. 2 more were down within 90 seconds. By the time Evan had assessed the contact and understood that the ambush was not a chance encounter, but a prepared kill box built specifically around his team's actual positions. There were 3 people left alive and nowhere to fall back to that was not already covered. Before the deployment, a logistics coordination officer had requested a frequency change on the satellite radio protocol, citing Russian signals interference in the operational area. The request had gone through the appropriate channel and had been approved without unusual scrutiny, because frequency adjustments were routine, and the stated reason was plausible. What the adjustment had actually done was shift the team's transmissions to a band being actively monitored by a third party, and every position update, every check-in, every piece of movement data the team had transmitted over 4 days had been received in near real time by the people waiting to kill them. Someone inside the system had arranged it. The network that person belonged to carried the designation Goliath. Evan did not know the individual's identity. He knew the mechanism, he knew the damage, and he knew that when he had understood what was happening, he had made the calculation that calling for extraction would send a rescue helicopter into a prepared anti-air position. So he had buried the radio, activated the Siri protocol, and made himself into something that could not be used, not by the enemy, and not, as it had turned out, by the people trying to save him. He said all of this to Tessa in the same measured, factual voice he would have used to read a weather report, and she listened without interrupting, because she understood that this was not a story he was telling. It was a transfer of information, carefully packaged, being handed to the one person he had determined could carry it safely. When he finished, he told her what he needed. He did not want the debrief going through Vance's command chain, or any of the reporting structures that fed into the same oversight layer that had processed the original frequency change request. He wanted her to contact her former handling officer at the NSA, the specific person, not the institution, using a one-time pad encryption method that would not route through any shared infrastructure. He said he understood that she had been out of that world for 3 years, and he said he was asking anyway because she was what he had. Tessa said she still had the contact. She said she knew how to reach him. She said the information would get to the right place through a channel that Goliath had no reason to know existed, and that the people Evan had lost would not have died for nothing. Evan looked at her for a moment, with an expression that had to do with the specific strangeness of being seen clearly by someone you have never officially met. Then the expression resolved into something simpler, and he let his eyes close, and within 2 minutes his breathing had shifted into the long, even rhythm of genuine sleep, not the locked-down withdrawal of the past 3 days, but actual rest, the kind the body takes when it has finally decided it is allowed to. 3 months later, Evan Rourke walked out of Landstuhl Regional Medical Center under his own power in civilian clothes, carrying nothing that identified him. The Goliath network had been located and dismantled through a process that generated no public record and will appear in no official history. Dozens of operators who would have been fed into compromised mission structures were not. Evan went back to the world he came from, the one that does not appear on maps, the one that most people will never know existed. Tessa Delaney went back to her shift in the ICU. She did not return to intelligence work because that had never been the point. She had left that world because it had cost her the ability to see the outcome of what she was part of. This time she had seen it clearly. The man had walked out of the building on his own 2 feet. She had first heard his voice 3 years earlier, through a classified feed on an afternoon she was not supposed to talk about. He had not known anyone was listening. She had spent 11 days watching the data his body produced, and had never heard him say anything that was not purely operational. She had not known his name. She had known his heart rate, his stress response, the way his physiological signature looked under the kind of pressure that breaks most people, and she had known that it did not break him. What she had not known until she leaned close to his ear in that hospital room and spoke 2 words she had no right to know was that her voice would be the thing that finally told him the fight was over. Some people spend their whole careers inside systems so large they never see the single life at the end of the chain. Tessa had spent 6 years in one of those systems, but on one quiet night in Germany, in a room full of machines that had given up, She found the one frequency his mind still trusted, and she used it to bring him home. If this story moved you, share it with someone who needs to hear it today. And if you haven't subscribed yet, there are more stories like this one waiting for you every single week. We'll see you in the next one.